Good afternoon, Michelle. How are you doing today?
I am well. How are you?
You know what? I think I'm doing all right. I'm feeling fairly positive about a strange thing where I just like, hey, give me that additional responsibility right now. And that's like, really on top of everything else, Patrick? But yes, and I'm feeling fairly positive about the choice to say, hey, can I have that to make sure it
Excellent.
happens? We'll,
Excellent.
we'll see if that was a terrible choice or not.
I hear you. I hear you. Well, the
Yeah.
program director thing is like, I asked for this, and I'm like, and why did I do that?
Interesting.
Oh,
Ah, okay. Hello, Armando. How are you doing today? Oh, and Dave, how are you as well? How's everybody doing?
Good.
Doing
Hey,
well.
Patrick.
Good. All right. We'll give like a minute or two just in case others are joining. If it's a small group, then we'll have extra time for questions and answers as appropriate as y'all want to do. But yeah, just hang out for a minute. How are your days going, Armando and Dave?
Going well. Getting ready for Halloween.
Mentally preparing for walking is how my day is going. In the cold weather with a bunch of little kids, I'm doing mental preparation for that.
Good for you.
yes.
All right. So we've got a decent looking group of folks. That is not a judgment on appearances, but just like we've got our numbers are increasing. So I'm going to go ahead and get started. All right. So good afternoon, everyone. Welcome to the Bidders Conference for the Syndemic Infectious Disease Bureau's Essential Support Services Request for Proposals. My name is Patrick Stonehouse. I use he, him, his, but anything with respect is fine with me. This whole thing's being recorded for future use. And I'm going to go ahead and get started sharing my screen, and we'll move through. Please let me know when you can see my screen.
We see it.
Lovely. Thank you. All right. So again, we're going to be discussing the request for proposals for essential support services put out by the Community Health Services Division of the Syndemic Infectious Diseases Bureau of the Chicago Department of Public Health. During this presentation, we'll talk about an overview of the portfolio of the Bureau. We'll talk specifically a bit about the essential support services request for proposals, and then we'll talk about alignment with the Chicago Department of Public Health's values, principles, et cetera, and how that pertains to the applications you submit. The portfolio is meant to be an interconnected system of services as opposed to like standalone contracts for each organization that are doing things siloed away from one another. And it's just based on a conversation I was just having with one of my colleagues. It reminded me like part of the idea behind having everything conducted through an interconnected collaborative system is to try and reduce that sense of competition between organizations with similar contracts. That like part of the intent of it is really like, what is the outcome of this entire portfolio? Not just your organization or those organizations funded under this RFP. It's like, how's this whole thing doing? Because that's like where we're able to like leverage each other's strengths, fill in gaps, provide supports, collaborate in that space. Because the end goal is not should not be did each organization achieve their scopes. That's an important thing for us to pay attention to, but the outcomes are the thing, right? And the outcomes are based on the experiences of the people who are accessing and ideally benefiting from these services. That was just sort of reminded me, like, oh yeah, that's one of the things that we were trying to accomplish with this. And so everything that we do is, whenever possible, it is meant to be this sort of system where folks are working together. And so organizations that are submitting their proposals should be like, this is what I think I'm going to be able to contribute towards that overarching interconnected system. And so like when we construct the RFPs, it's sort of designed like these are going to play off of one another and not in an overly explicit manner necessarily, but like as we're doing the contracting and implementation, we're looking at how all the stuff can work together. We do integrate funding across multiple funding sources for prevention, for HIV, for STI, for viral hepatitis, for care for people with HIV, HRSA ending the HIV epidemic, housing opportunities for persons with HIV, City of Chicago corporate funds, and Illinois Department of Public Health funds. We have, to the greatest extent that we could, integrated those funding sources in such a way as to allow organizations to provide services in a status neutral way, meaning that you are providing the same services to people with HIV and to people with a demonstrated vulnerability or risk for acquiring HIV. Similarly, we braid these funding sources together to try and allow organizations to use a syndemic approach. So looking at the experiences of individuals with HIV, sexually transmitted infections, viral hepatitis, tuberculosis, mpox, and other elements that come in and are experienced by those populations that are most impacted by syndemic infectious disease as they occur. And of course, everything we do needs to be in alignment with our priorities on a local level, on a state level, and on a national level, so that we're aligning ourselves in terms of the service delivery and the outcomes we're focusing on accomplishing, so that, again, we're able to provide the greatest support for those populations most impacted. Roughly speaking, the services of the portfolio fall into 4 buckets. So we'll start with housing, which is exactly that. It is housing opportunities for persons with HIV and housing opportunities for persons vulnerable to HIV. Health equity, which is a combination of services and activities that are funded specifically to focus on populations that are most impacted by HIV, and the way in which we evaluate the data that comes from all services, where we have a focus on looking at the access and benefits that are being experienced by individuals who are members of those populations that are most impacted by HIV, as well as some contracts we have in place that are specifically looking at systemic and structural barriers that are experienced by those populations, working with those populations to identify ways of eroding or ideally removing those barriers so that we're able to see the population level access and benefit increase. Healthcare, which is the clinical services involved in providing care for persons who are experiencing syndemic infectious disease. And how to is around this sort of like resource coordination, supportive services, making sure folks have the knowledge of what is available, are able to access what is available, such that they can then achieve the desired health outcomes that we have as a jurisdiction. And everything we put into practice with this portfolio is based on this image, this path. And this was developed back in 2018 in collaboration between CDPH, our Community HIV Planning Council, community members, organizations. This is not a thing that we came up with and just applied. It was a thing that was developed and refined over months and months and months with a number of parties. But the idea of it is that all individuals who are eligible for the services that we support start with a point of recruitment and screening. Screening then identifies whether a person has HIV or has a demonstrated vulnerability to HIV. And then either way, there are these steps that lead towards the desired outcome that we have, which is, durable viral suppression for people with HIV, and long-term adherence to pre-exposure prophylaxis for people with a demonstrated vulnerability towards HIV, or whatever their particular individual prevention or care strategy is within that particular space for persons vulnerable to HIV. And to support all those, that progression is where we have all of these supportive services that are provided by a number of organizations that allow an individual to overcome any barriers they are experiencing so that they can take these steps towards the desired health outcomes. And surrounding all of this are these other elements like marketing and communications, resource coordination, community development, which is the systemic structural interventions that I mentioned earlier, services for people who inject drugs, which we refer to as services for people who use drugs. This is a collection of harm reduction services and supports that was housed within the Community Health Services Division of the Syndemic Infectious Diseases Bureau until this summer, at which point it was transferred over to the Behavioral Health Bureau of the Chicago Department of Public Health so that they can integrate it with other contracts and services and funding that they have that go towards similar activities. So they can integrate in with their like drug testing and overdose prevention strategies that they've already got with other contracts, and now it just puts it all together in a single place. And then again, housing, which is the housing opportunities for persons with HIV, housing opportunities for persons vulnerable to HIV. And one thing I think I've neglected to mention in other bidders conferences is this also includes our ability to support organizations in connecting individuals with other housing systems that maybe have nothing to do with HIV, but for which individuals may be eligible for accessing based on other things going on. So now to the Essential Support Services RFP. So we, as the City of Chicago, acting through the Chicago Department of Public Health, are seeking qualified organizations to provide essential support services, which is a collection of non-clinical services designed to support recruitment, screening, linkage to medical care, and other support services for people with HIV and individuals with a demonstrated vulnerability to HIV, with prioritized focus on those populations most impacted by HIV. There are multiple funding sources involved in this. Currently, we do have 4 contracts in place to implement the Essential Support Services programming. These contracts end at the end of February 2026, and you can see those organizations right now. And again, the idea is that we're looking for organizations that are going to implement either directly or through subcontract a strongly coordinated collection of supportive services for people with HIV and people with demonstrated vulnerability or risk for HIV, including really strong relationships with clinical providers, because as you know, the end desired health outcomes are these like adherence to medications and durable viral suppression, which are clinical outcomes involving clinical services. There needs to be a strong connection between the organizations implementing essential support services and some entities that are providing that clinical side of things. So looking for really strong relationships in those spaces. And there is approximately $2.175 million available through this RFP. The contract period will be March 1, 2026 through February 28, 2028, with up to 2 one-year extensions that will be made available at the discretion of the city based on availability of funds, demonstrated need for services, and performance of the delegate agencies. Just a note that the reason we have an approximate amount of funding available is a couple of things. Partially, or actually the biggest element of it is that the funding allocations to different service categories within Ryan White Part A, which is the dominant funding source for this RFP, need to be determined by our Community HIV Planning Council. So they tell us, you're able to use like Y% of all of your award to support psychosocial support services or substance use or outreach or what have you. So they are the only entity that is able to say what percentage of our award goes to each service categories, and we are required by law to adhere to that direction. So they're still in the process of finishing their resource allocation work. Once we get that, we will apply it to all the different RFPs that have different service categories, and we'll make it work in that space. And we will be aligning with their resource allocation direction in the execution or the awarding of contracts that are going to go out to all of the different organizations involved in all of the portfolio, the entire portfolio of RFPs that we're putting out. And you'll see here, in addition to the Ryan White Part A funds, there's also CDC high impact HIV prevention and surveillance funds and City of Chicago corporate funds. We're operating on a March 1 through end of February timeline because that is the budget period for Ryan White Part A, which again is the dominant source of funds for this. Centers for Disease Control, their funding period is June 1 through May 31, and the City of Chicago corporate funds operates on a calendar year. So all of this stuff needs to be incorporated in like how we manage the finances over the course of a period of time. But just so you know, we're mapping the CDC and the City of Chicago cycle for this award to the Ryan White Part A funding. All right, so common among all of our RFPs. So as proposals come in, organizations, and this is all in the RFPs that we've put out, there are a certain amount of points assigned to each category of prompts or questions. And each category is made up of multiple questions. Each one of those questions is assigned a point value. So you're able to see that, exactly this in the table. So community reach, which is the space wherein applicants can talk about connections, like where they have services, where they have offices, where they have community connections, to describe the strength of relationships they have with communities, both in terms of geography and in terms of population. All of this goes into that space. Alignment with CDPH guiding principles is worth 9. Program design, scope of work, activities, and outcomes is worth 40 points. Staffing plan 10, budget justification and fiscal capacity 10, and quality improvement, evaluation, compliance, and data management is also worth 10 for a total of 100 points. So when proposals come in, they are first sort of screened for all right, did they complete the application? If you didn't complete the application, your proposal gets kicked out. But if you completed it, it then goes to a panel of individuals who will review each and every single proposal. And the way that works out is we will have multiple panels, each with no fewer than 3 people, and it must be an odd number of individuals. And at least one of those individuals must be someone who does not work for the Chicago Department of Public Health. Each panel will review the same collection of, or each panel will review a set group of proposals. So panel 1, every member of panel 1 will review the same proposals. And no individual is meant to review more than 6, although ideally 5 proposals, otherwise it gets all muddy. So when the individuals review those proposals, they have like a scoring sheet basically where they assign points for every response that is given. And then they also provide comments of strengths, weaknesses, and other observations they've made related to the responses from that particular proposal. Those scores then get totaled up, and we as in CDPH then look at the scores from the reviewers, and if we see like significant discrepancies or like a range, so like reviewers 1 and 2 said this proposal was like an 87, reviewer 3 said it was 6. All right, well, something's got it going on there that's making such a divergent range of scores. So we would then bring the group together and discuss with them what they're seeing in the different spaces and work towards coming to a consensus of where they feel the scores should be. And that then becomes the aggregated score of each proposal that comes through. When we look at the aggregated scores of each proposal, if a proposal has an aggregated score of less than 80 points, so 80 points out of 100, that proposal is not going any further. So you need to have at least 80 points out of 100 in order to be considered for an award. In the event that no proposal has a score of higher than 80, the whole thing gets kicked out and we have to start all over again. So nobody has any incentive to not score well, but we do need to have quality applications coming through. And I have actually seen this happen where like we got to start the whole thing over because none of these proposals got a high enough score. Sincerely hoping that doesn't happen. So again, all of our RFPs, I should say, need to align with the guiding principles of the City of Chicago. And that includes Healthy Chicago 2025, which is the city's plan to address the life expectancy gap experienced by Black and non-Black Chicagoans, or Black Chicagoans and non-Black Chicagoans. So Healthy Chicago 2025 has like a bunch of different areas where we need to focus our energies. And one of them is like communicable disease, chronic illness, et cetera, wherein we see like HIV, viral hepatitis, et cetera, going into that space. When we're looking at proposals, and when we're constructing this RFP, our thinking is that this collection of services and how it fits within the whole portfolio works towards supporting individuals who are of our priority populations, which includes Black Chicagoans, providing additional supports or focused support services to assist them in addressing the other elements of their health and of their lives that may be acting as barriers to accomplishing the desired health outcomes we have. So these supportive services come into play to support individuals in making those steps towards the desired health outcomes of durable viral suppression and adherence to whatever an individual's prevention strategy is. But our priority one is pre-exposure prophylaxis. And so when we look at when you're putting together your proposals, you want to talk about this is how we're going to focus our energies in this space. And when we look at proposals, we're going to be looking for how our organizations identifying that how they will be focusing on those populations that are most impacted by HIV. And it's important for folks to know that, yes, we're looking at that in terms of the proposals, and we're looking at that in terms of the performance. So it's not like we submitted our proposal, we don't need to worry about this anymore. No, like on a monthly basis, we're looking at who's accessing services, who's benefiting from services, what kind of health outcomes are we seeing, both in terms of the general collection of individuals who are accessing the services, but also stratifying that and looking at the different populations that we're focusing on, such that if we're able to see, we'll take it within essential support services, let's say like 92% of all individuals who are referred to pre-exposure prophylaxis clinical providers fulfill that appointment, like get the appointment and get a prescription for PrEP. Cool. But if we see like 30% of Black women get that prescription, all right, well, then that's a problem, right? So we need to be able to focus in and see for those priority populations, those populations that are most impacted, what's the access, what's the outcome, what's the performance in terms of their experiences of the services, not just across the entirety of folks who are accessing these services. Okay, so organizations, again, we're looking for alignment with our mission and vision in terms of our mission in Healthy Chicago 2025, which used to be referred to as the Dismantling Racist Systems value, but we had to change that language. We're looking for general alignment. We're looking for how this is implemented or how this comes across through leadership and decision making, how organizations are holding themselves accountable to those populations that are most impacted by syndemic infectious disease, but also that are most impacted by the racist systems in which our country operates. We're looking for how your organization plans on providing trauma-informed services and doing work to prevent additional trauma in terms of both the clients and the staff involved in these services. Transparency in decision making and trust, and how your organization builds and maintains trust at all levels. And again, that's clients and staff and community, and how you would demonstrate that you have an understanding of the historical traumas that are experienced by these populations. And last on this slide, at the very least, is looking at health disparities, which again, previously we referred to as health equity, but we had to change that language. I'm still surprised that they let me keep that exact thing in this slide, but I love it. But basically, like, how are you going to use your own programmatic data as well as other data sources to identify disparities that are experienced by different populations? And then how are you going to make adjustments in the services, policies, and practice to address those disparities? And of course, we want to know, like, all right, how have these different populations been involved in the design of this program? How are they going to be involved in the ongoing maintenance of this program, the implementation, the evaluation, the adjustments that need to be made? How are you going to involve populations and community advisory groups in that manner? And this last part is about, like, all right, and where and who, right? So we, as the Chicago Department of Public Health, are responsible for implementing programming and funding toward a range of geographies, right? So the Ryan White Part A grant and HRSA ending the HIV epidemic grant, those go towards the Chicago eligible metropolitan area. The CDC funding, the City of Chicago funding, those go towards just the City of Chicago. Other funding sources like HOPWA, Housing Opportunities for Persons with HIV, those go to the eligible metropolitan statistical area. So We are looking for information coming from your proposals that identifies like where you've got it, services that you're going to be able to do through this funding, but also through other activities that you've got going on. And what populations are you working with? And then our job is to look again at all of the proposals that come through that get successfully through the review process and figure out what is the best way for us to provide coverage for the entire eligible metropolitan area through these different organizations, their proposals. And there may very well be like, all right, this collection will work, but we'll may need to talk with this agency to make some adjustments so that this space over here has some access to services based on the number of people who would be eligible to access those services. So we want to basically see what the proposals have to offer. Again, it's like this is what we can contribute to the jurisdiction, and then our job is to work across all of the successful proposals to make sure that we've got appropriate coverage for the entire jurisdiction. And that's the presentation. So if you've got questions, there are multiple paths. One, you can always send an email to John Pfeiffer. He's our Assistant Commissioner for Contracts Administration. You can send emails to myself or to hivfunding@cityofchicago.org. You can upload questions into the iSupplier portal, or we can have a conversation right now. And just all questions and answers that are submitted, all questions that are submitted are going to go into a document where I will provide the formal written responses. That document then gets reviewed by others to make sure I'm not saying anything that's going to get us in trouble. And then once that review process is done, it goes to a public-facing website, I believe, where folks can go and see all the different responses that we've provided. So in that vein, while you are, of course, welcome to verbalize any questions within this space, I'm going to be taking notes, but also a humble request that if you have the capacity, if you can write your questions into the chat as well, so I can just copy them and put them into that document, that would also be helpful. And that then takes us to y'all. What questions have you got? Oh, Michelle, I see you've got one in the chat. Thank you for that. So you want to see the funded agencies? Sure. I'll just share that right now. But yeah, the agencies that are currently funded for essential support services are Southside Help Center, Center on Halsted, Chicago House and Social Services Agency, and Haymarket. Okay. What else y'all want to know?
I know
Yeah,
Armando and I met before, and he's, typing one in.
Okay, RFP indicates that there's approximately $2 million available. Yeah, thank you for this. It is per year. Michelle, were you gonna say something?
Yes, if I can find the unmute. No, I was just, I wanted to participate in this just from some of our discussion from the PCHH yesterday, just to kind of differentiate essential services from some of the stuff that the PCHH was doing, as also just kind of distinguishing from the syndemic testing in healthcare settings versus these services. Some of our folks were interested in the testing, and they were thinking that essential services was that grant, and I'm like, I don't think so.
Nah. Okay, so I can do this. So, and I'll give you the full history because I like doing that because it was a fun experience. Back in like 2016, 17, 18, we did like 2.5 years worth of engagement with community members, partners, delegate agencies to come up with all this stuff, right? And one of the first things we established was the population-centered health home model, which is meant to be basically like the one-stop shop for clinical and supportive services for individuals with HIV and demonstrated vulnerability. And then a bunch of folks were like, well, what if I don't want it all in the same place? And we're like, that's a good point. Or, well, what if we split? So you could go to a population-centered health home and get everything, or you could go to just your HIV primary care provider, which came into the RFP for HIV primary care, and then you can get all your supportive services somewhere else, which turned into the essential supportive services RFP. So that's how those three came together. So basically, if you put essential support services and HIV primary care together, you have a population-centered health home, right? The big difference between any of those and the syndemic infectious disease screening in clinical settings is that the healthcare setting screening is designed to be routine screening in clinical settings. So all the screening involved in your population-centered health home or essential support services should be based on an understanding of the individual level or demonstrated concern or risk for HIV and syndemic infectious disease, whether it's social networking strategy, like population-based recruiting, what have you. That's all fine, but it should be like this person, there is a reason that we are screening them based on their individual level experiences, versus syndemic infectious disease screening in clinical settings is like, you're here, we're going to screen you. Right. And one of the things that comes out of that is that frequently, like for the vast majority of people who screen through the healthcare setting model, like if you were to ask, like, all right, well, what risks have they got? Like, we don't know, because that's not what it's about. Like, you came in with a broken knee and we screened you for HIV, viral hepatitis, and sexually transmitted infections. If you get a reactive result for any of those, then the ongoing follow-up to connect an individual to clinical care or cure or treatment, that's where you can get a lot of that information. But if you don't have a reactive result for any of that stuff, we will not know, because that's not the design of that particular model. Thank you for that question, because it reminds me how much I love talking about this stuff. Okay.
Thank you for the explanation.
All right. Armando, you wrote in service categories, EIS. All right. Copying it. All right. So the service categories are early intervention services, non-medical case management, outpatient services, psychosocial support services, mental health services, substance use outpatient. Will agencies that apply have to go for all service contracts? Excellent question. So the way it works is you tell us, basically, so an organization that is implementing essential services is required to do all of those things. You are not necessarily required to use our funding to do each of those things. So you can say, like, you know what, we got psychosocial support covered through another funding source. We're going to do it and we'll report it to you in aggregate, but we don't actually need your money for it. That's fine. But you're going to have to do it, and we're going to have to know that it's being done and all that stuff. Like, there's still evaluation. But if you're able to say, we need the funding from this RFP to go towards non-medical case management, substance use outpatient, and honestly, we got the rest of it covered, that's an acceptable proposal. Does that answer that, Armando?
Yes, and thank you, Patrick.
Of course.
And Patrick, I do have one question because I missed a few of the CDPH meetings recently. Was I correct that ESS at one point was going to potentially be somewhat phased out or sunsetted, or did I just completely misunderstand that?
No, it absolutely was. So there was what we were trying to do was we were at one point going to be getting rid of essential support services and replace it with something else. that provides some kind of network of supports and services for people with HIV and a demonstrated vulnerability. And really, as y'all know at this point, like we way expedited our process for getting the RFPs out, and what that left us with, I don't have time to figure out what those replacements are, so let's just do it, put it back out. We'll see what we have learned. We'll see what organizations have learned through their implementation of essential support services for the last 6 years, what we've learned from the data, how we need to provide a different level of support for these organizations so that they're able to have a greater level of success from what we had seen prior. And just one of the reasons for that idea of like, all right, well, let's get rid of what we've currently got here, is that we weren't seeing success in all of the spaces. You know, like it was like some agencies are rocking it in this category and like not in this other one. And this other organization is doing really well over here, but not in this. And when you looked at them across the board, like if you aggregated all essential support services, service delivery, unique number of individuals and outcomes together, it was like, all right, this is actually pretty cool. Looks good. But then when you break it down, like, oh, this isn't working. And we knew from looking at the client level data that it's not that like an organization over here touched a person and then passed them along to another organization to provide the thing that this first organization was weak in. It's like that person's gone. This agency over here is doing something awesome with people who are also not connecting with the services over here. So like that idea of the network of the essential support services agencies wasn't playing out. And so that's where it was like, all right, this isn't working. We need to figure out another way of doing it. So we ran out of time for creating a new like construction of services. And so it's really going to be on the implementation and the support that we're in evaluation that we're able to provide to make sure that we're correcting based on the experiences of the last 6 years.
Okay, that's really helpful.
I think I have 2 questions more. My first question is, I tried to type it out, but it's not making any sense. And it's also silly, so just throwing that out there.
Love it.
So I see that the RFP, of course, indicates that staff are not permitted to serve as volunteers. But are there any regulations for volunteers that are interns? Part of the reason why I'm asking this question is I'm thinking about the program implementation and bringing on interns to be able to do some of this work. So I'm just wondering about that. Are interns considered volunteers under the specific regulation?
Let me look into that so I can provide a concrete response, but I think it's going to be interns would be I think it might depend on what they're doing. So my guess is going to be like it'll be a case by case to figure it out, but let me take a look and make sure that that's accurate based on everything that we've got to deal with.
Sounds good. Thank you, Patrick. My second question, before consuming too much of this space, is so are there any changes in the monies available from the last application cycle in 2019 to now in 2025? And if so, how did that affect sort of going down to 2 to 3 agencies for being provided the service contracts?
So first answer is still to be determined, right? So we, as I mentioned earlier, our allocations of specifically the Ryan White Part A funding is legislatively required to align with the resource allocation of our Community HIV Planning Council, which is the Chicagoland HIV Integrated Planning and Action Council. Did I get that right, Beto? I think I got that right.
Chicagoland HIV integrated and acting. No.
Okay, don't worry about it.
It's
Thanks,
long.
Beto.
Check back.
Thanks, Beto. So that body does the work of the resource allocation. So they and only that body can say that the Planning Council is the only entity that is authorized to say this percentage of your funding goes to each of these different service categories. And they're still in the process of finalizing that. So once that is completed, it comes to us as CDPH, and then we map that out across all of the RFPs and all of the awards within the RFPs to say how much money is available for the different things. So what you see in the RFP is an estimate based on what we did last time, and acknowledging that there may very well be changes. So for example, and this wouldn't, I would be shocked if this happened, but let's say the Planning Council comes back and is like, you know what, we don't want to allocate anything to early intervention services. Well, all right, well, that's going to change the amount of funding that's available through essential support services, because EIS is a component of that. So that gets kicked out. And it depends on whether they, redistribute those resources to other service categories. So to an extent, it is still to be determined. The 2 to 3 agencies involved, I think, look at that as being a possible range. But it really is, all right, well, let's see what happens based on the funding allocations that we get from the Planning Council and based on the quality of applications we receive from organizations. So if we get only 2 organizations that submit really good proposals, all right, well, then we'll probably have 2. But if we have 6, all right, well, maybe we'll have 4. We'll see what happens. We'll see what comes through the proposals and the funding allocation. All right. What else you got? Thanks, Beto. Chicagoland HIV Integrated Planning and Action Council. That's our community HIV Planning Council. And if anybody's interested in joining, Beto is co-chair of the membership committee. So Dr. Beto. Nice. All right, we have 18 minutes left. If anyone has any further questions, please, again, put them in the chat. Let me know. Again, this whole thing is being recorded. It'll be reviewed, as well as all of the comments and questions that I get through the chat and other spaces. All of that gets put together in a formal document that then gets published so folks can see it. Yeah, I'll be here for another 18 minutes if y'all have more questions or the things you want to talk about related to essential support services or other things.
Patrick, I do have more, not specific to, I mean, it is specific to this, but more out of curiosity. The CDC portion of this funding, I'm very intrigued because everything is very just kind of amorphous nowadays and nothing fully makes sense. But is that funding that has been secured, is pending approval at the federal level? Because obviously the CDC portion that we had earlier this year didn't come through. I'm intrigued. I'm curious if what's going on with that.
Sure. So part of what we're going to try and do with the balance of CDC and City of Chicago corporate funds sort of together is to see how we can best offset any changes that may happen with our CDC funding, so that we still have some resources in place to be able to do the PrEP side of things, right? Because Ryan White cannot be used for anything for an individual after they've been identified as a person who does not have HIV. So that CDC funding and that City of Chicago corporate funding come in specifically for that. And that's why I think all of the RFPs, you'll see this is much as available between sort of these 2 spaces to see what we can do. Because, I mean, number one, we do not have, we have right now we have our funding from CDC that runs through the end of May 2026. So like the first 3 months of this contract. But after that, it's a new budget year for that CDC grant. So it is all right, we'll see what they give us at that point. And honestly, same for City of Chicago corporate. You know, budget hearings are happening like right now. So this is based on what we assume or what we are proposing we will have in terms of City of Chicago corporate funding to support these activities. We shall see what happens. And my strategy or my thinking on it is I'm going to put forth what we want to have happen. And if the funding for whatever source doesn't come through, we can walk it back. And the reality just of our procurement process is that you cannot do it the opposite direction. If we limited the essential support services RFP, let's say, to just Ryan White Part A funding, and then later on we're like, oh, cool, we got a bunch of CDC or corporate funding, we cannot add it to the contracts. We would be able to add it like on a year-by-year basis, which is a giant pain for everyone. But so the idea is, all right, let's just put it all on there. And if we need to reduce, we can, again, because we can't add on for a multi-year contract.
Okay, so right now the city has funds, but not probably waiting to see if more funds could potentially come in.
Well, on both the CDC and the corporate funds, it is, you know, we're approaching or we're seeing the end of the budget period, and we will see what funding we get. You know, everything's based on the availability of funds as they come to us. So it is a let us see, and this is a from my experience, and I think what we're all seeing. Like honestly, even if we get a letter of award tomorrow that tells us how much CDC funding we have for June through May of 27, there is demonstrated evidence of like, all right, we're taking that back. So we will do the best that we can based on our understanding of what we have resources for at that moment, and what we see as being the greatest opportunity to provide support and benefit to those populations we're focusing our energies on. And as that changes, we adjust.
Makes sense.
I don't think I have any more questions on my end.
Okay.
Thanks, Patrick.
Yeah, thanks, y'all. Yeah, I will be here for the
Thank
next 12 minutes because I have to be just in case. So if you come up with something, feel free to jump back on. I'll be here. Thanks, y'all.
Yep.
you, Patrick.
Thank you. Bye-bye.
Bye.